Hi guys, welcome to Pills and Things, where today we will be talking about medications like Jardiance, Farxiga, Invokana, and Steglatro, which are in the SGLT-2 inhibitor class. So first I'll be talking a little bit about the mechanism of action of these medications, and then basically just going over some pros and cons or benefits versus risks with these medications. So the mechanism of action for this class of medications is they basically block the reabsorption of sugar in the kidneys and this increases the amount of sugar that comes out in the urine. So simply put, it literally makes you pee sugar. Now, peeing sugar is a good and bad thing. The good thing is that it lowers your blood sugar, it lowers your A1C, which is good when it comes to diabetes, because you're literally peeing sugar, you're losing calories that way, so it does contribute a little bit to some weight loss as well. A few other benefits with these types of medications is lately there's been some more studies about heart disease benefits with Invokana, Farxiga, and Jardiance specifically, and also even some kidney disease protection benefits as well with also again Invokana, Farxiga, and Jardiance. The more recent American Diabetes Association guidelines are even now recommending, if you have heart disease or kidney disease, they are recommending these types of medications to be added on after metformin if the doctor deems it appropriate. Farxiga can even be used in heart failure for patients without diabetes due to some recent studies. And another good thing about these types of medications is they have minimal hypoglycemia, so there's low risk of low blood sugar episodes happening, which is a big concern for other types of medications. So I mentioned that peeing sugar can also be a bad thing, and it can be a bad thing in that when there's more sugar in the urine, there's more kind of food for bacteria and yeast and things to feed off of, and so there's a higher risk of genital yeast infections and urinary tract infections, UTIs, and even a risk of something that's pretty rare but very severe if it happens, called Fournier's gangrene, which is also a very severe infection that can happen there. And some other cons for these types of medications is that there's no generic available. So these are potentially expensive depending on your insurance, if you have insurance. Some other side effects that are common with these types of medications are dehydration. They do have some kind of diuretic-like properties, so you do lose a little bit more fluid with these medications, and that can lead to dehydration, so make sure you're staying hydrated. Related to that, low blood pressure, that could be a good or a bad thing, but if you're losing fluid, blood pressure can sometimes go down, and if it drops too low, that can be a bad thing. You get dizzy and fall and things like that. Also, there's more frequent urination, so if you have any bladder trouble, that's also something to note. Related to the dehydration and the fluid loss, sometimes there is acute kidney injury. If you're dehydrated, sometimes that can hurt the kidneys. So again, hydration is important here. There's also risk of something called ketoacidosis. It's very rare, but because of that, the FDA is recommending to stop these medications a few days prior to any surgeries just to prevent this from happening. And a few other kind of side effects that I would mention is just more specific with Invokana, but there's some associations with rare amputations, decrease in bone density, high potassium or hyperkalemia is the other name for that. And there was a concern at one point of fractures with Invokana. It's a little controversial. Looks like more recent studies show no increase in fractures, so that's something to note as well. But these are kind of some of the side effects and notes, or just things to keep in mind with these types of medications. Before I finish, I just wanted to make a little disclaimer. This video is for educational use only. This video is accurate to the best of my knowledge as of the date posted, but data is always changing, so always consult your doctor and pharmacist regarding your medications and what would be best to do in your specific situation. So that's it for today. If you found value from this video, please hit the like button. If you learned something from this video, please share it with a friend or loved one that you think might benefit from watching it. If you want more content on health and medicine, make sure to subscribe to the channel. This channel is dedicated to teaching you about medications, medical conditions, and general health-related topics in a simple and easy to understand way. I'm planning on making the next video on another class of medications used to treat diabetes. So stay tuned. Thank you for your time and stay healthy. See you next time.